Bioethical issues encompasses a range of complex concerns, including beginning-of-life issues like abortion and reproductive technologies, sustenance of life issues like life support and nutrition, end-of-life issues like euthanasia and palliative care, and information and research issues like genetic research and informed consent, all of which required careful consideration of moral, ethical, and the legal principles. Beginning of life issues. The moral dilemma of abortion and the biological issues produced by modern technologies are among these. Abortion raises complex ethical questions about the moral standing of the fetus and the condition under which intentionally termination is justified, and the concept of personhood, sparking debates about fetal rights, woman autonomy, and the value of human life. Assisted reproduction technologies, or ART, provides alternatives for individuals and couples struggling with infertility, offering various methods to conceive a child beyond natural conception, including options for a single or unmarried individuals and those requiring donor service. The use of technologies like IVF, surrogacy, and donor gametes raises questions about the nature of parenthood, genetic identity, and the commodification of human life. Cloning raises significant ethical concerns, including embryo mortality, exploitation of human life, potential for handicapped offspring, and issues of identity and autonomy, as cloned individuals may face pressure to meet predetermined expectations and be treated as products rather than individuals with inherent value and rights.
Organ transplantation. Organ transplantation can save and prolong life. It entails transplanting a deceased or living organ into a recipient to replace the failing organ. Organ shortages have killed several patients. Thus, we must find socially acceptable means to obtain additional organs for transplantation. These standards prioritize donors and recipient rights and well-being. However, others consider these restrictions or overprotective and questions their morality. Example na lang, kung ang isang tao ay may sakit sa puso at kailangan ng isang donor mula sa isang taong namatay o buhay patungo sa isang nangangailangan upang palitan ng isang organong hindi na gumagana. Ang paglipat ng organo ay maaaring magligtas sa isang tao o magpahaba ng buhay. Genetic medical procedures. Advances in genetics have generated new medical procedures for dealing with diseases attributable to gene defects. These procedures include genetic testing and screening, gene therapy, and genetic enhancement. Genetic testing and screenings. Seek a genetic element. Genetic testing determines if a person has the gene that causes the disease in their family. It is then determined how probable they are to have the same sickness again. Example, kung ang isang babae ay may kasaysayan ng breast cancer sa kanilang pamilya, maaaring sumailalim siya sa genetic testing upang malaman kung taglay niya ang BRCA1 o BRCA2 gene mutation. Kapag siya ay nagpositibo, mas mataas ang tsansa niya magkaroon ng breast o ovarian cancer kumpara sa karaniwan. Sa tulong ng impormasyong ito, maaari siyang gumawa ng mga hakbang upang maiwasan ang sakit. And last, the genetic screening. The genetic screening determines the prevalence of the genetic factor in the group. Gene therapy. Ang gene therapy ay kinabibilangan ng pag-aalis o pag-aayos ng mga sakit sa pamamagitan ng pandaragdag at pagpapahayag ng genetic material na pumapalit o nag-aayos sa mga nawawala o sirang tungkulin o pumipigil sa mga prosesong nagdudulot ng sakit. Genetic enhancement. This type of genetic enhancement is a hypothetical example for humans. It showcases how gene modification can potentially improve a specific system like muscle growth in our body. Healthcare resource allocation. Healthcare resources are any goods and services that can reasonably be expected to positively affect health, according to Buchanan 2009. They include resources such as medical drugs, procedures, and treatments. Resource allocation may be done in a macro and micro level.
End-of-life issues. Euthanasia. Euthanasia means intentionally ending someone's life to relieve their suffering, often called mercy killing. Frey 2010 says it's done with kindness, and Dickens and Boyle 2008 explain it as a way to help someone by ending their pain. Doctrine of double effect. This ethical idea says that an action with both good and bad effects can be okay if the action itself is neutral, the bad effect isn't the way the good outcome happens. The goal is the good outcome. The good outweighs the bad. Grudge 2009. Brain death and vegetative state. There are three ways to define when someone is dead. Number 1. Cardiopulmonary death, when the heart and lungs stop working permanently. DeGracia 2011, Looper 2009. Number 2. Whole brain death, when all brain activity stops, including breathing and reflexes. Shemi 2009 says this include coma, no breathing, and no brainstem reflexes. Number 3. Higher brain death, when only the upper brain, which controls thinking and awareness, stops. Patients may still breathe but are unconscious. McMahon 2009 believed this patient can be considered dead, allowing organ donation or euthanasia.
Information and research issues. This area of bioethics covers healthcare professional obligation and patients' rights regarding medical information and research involving human subjects. We examine how these elements shape the doctor-patient relationship and the integrity of medical research. Truth-telling and informed consent. The practice of truth-telling in medicine has three reasons. The first reason is based on Kantian principle of respect. Kantian ethics emphasize respect from autonomy. Patients are autonomous individuals deserving of honesty. Truth-telling aligns with this principle by recognizing patient agency. The second reason is utilitarian in nature. Utilitarian nature is justification of truth-telling. The benefits of truth-telling are better health outcomes and compliance. The harm of suspicion includes distrust and proper outcomes, balancing benefits and harms. From a utilitarian perspective is essentials. The third reason lies within the covenant of trust between the doctor and the patients. The doctor and patient relationship as a covenant of trust. Truth-telling is essential for maintaining the trust. Honesty fosters a strong and more effective relationship. Informed relationships. Obligation to tell the truth. Still, despite this, is traditionally believed that doctors are morally justified to deceive or tell a lie to their patients in certain circumstances. This ethical dilemma lies in whether the doctor should inform the patient of a critical condition, lessen his hope, or deliberately mislead him and improve the chance of survival. By insisting hope, giving their knowledge and expertise, doctors are not better positioned to know that is best for their patients. In some cases, doctors find it more beneficial not to tell the truth to their patients, which is called medical paternalism. The reason for this is that a doctor must act in a patient's best interests, even if the patient does not know his/her best interests are, and patients are incapable making medical decisions because of the technicality. Medical paternalism is this concept suggests that doctors, due to their knowledge and expertise, can override a patient's autonomy by making decisions on their behalf even if the patient does not agree or understand the reasons. Informed consent is considered not just a moral but also a legal requirement in treating patients. Related to truth-telling, it becomes an important component in the validity of the consent given by the patient. For consent to be informed and those valid, the patient must be properly told the truth and must clearly understand the truth regarding his/her
medication condition. Giving treatment without informed consent will cause the doctor liable for negligence, assault, or medical malpractice. Requiring physicians to inform patients about their medical condition, treatment option, risky and benefit, and ensure patients understand this information before making a decisions.
Example of confidentiality. In hospital, a nurse learns that patient has been diagnosed with a serious illness. The nurse does not share this information with friends or family without the patient's permission. Explanation. This is confidentiality because the patient's health information is sensitive and private. The nurse has professionals and ethical duty to protect that information and only discuss it with people directly involved in the patient's care unless the patient agrees to share it. The example of the use of human research. A university is testing a new drug to treat high blood pressure. Volunteers agree to take the drug and be monitored over several months to see it lowers their blood pressure efficiently and safely. Explanation of the human for research. This is human research because real people are participating in a scientific study. They are being observed and tested to help researchers learn how to drug efficiently the body. Before joining participants, most give information consent, meaning they are told about their risk, benefits, and purpose of the study. And agree participate voluntaries, ethical rules are in place to protect their rights and safety.